Hello, friends and colleagues. I'm Donna Lalwani, Clinical Outreach at Amen Clinics, and I'm joined by my colleague, physician Dr. Ishi Sood from Amen Clinics, New York. It's a pleasure to see you, Dr. Sood.
Good to see you, Donna.
Thank you for being here. So, tell us a little bit about yourself.
So, I am an adult and child psychiatrist. I work at the Amen Clinics in New York. I've been working here since 2014. And I'm excited to be connecting with you.
Well, there's a lot of time of change, and I'm just sort of going to ask you a little bit about what you've been finding at this time, and how have you been interacting with clients during this period under COVID-19 and coronavirus?
Yeah, this has been an extremely difficult time, extremely challenging time. One that we've never seen, and there's been a lot of uncertainty. There's it's just led to this sort of collective grief, and it's been really sad on so many levels. But what's been awesome is that there are ways to sort of approach this in a way in which one can cope strategically to sort of develop habits that can help us sort of get through this time. So it's new. It's a new frontier. I believe we'll get through it, and we'll talk about maybe some steps that can help us get there.
We welcome that. I think a lot of people are looking for that kind of information and other resources that can help themselves or someone that they care about and care for during this period. So, and what are you sort of noticing in this sort of time period, with appointments? I know, of course, our clinics are open, but, this is not new to us in the telemedicine frontier. So, how has this been for you? How's this been for many of your patients? What are you seeing coming in?
So, working in New York, we've been adopting sort of a telemedicine approach, meaning we're virtually connecting with our clients through video, mainly, also telephone. You worry or you think about, how is this going to benefit the patient, or how impactful our work can be. But it's been nice to really still be able to connect and really strengthen that connection. Generally, as a psychiatrist, we meet with our clients in the office. Now we're meeting with our clients in the comfort of their homes, and there seems to be a sense of ease. Maybe it's because the individual is in the comfort of their own home. There seems to be a sense of relief that they do have access during this time. I couldn't imagine if this sort of crisis hit us, before there was the ability to sort of connect virtually. So it's been quite surprising, and gotten a lot of positive feedback.
It's great to hear that we do have this use of technology in space to be able to reach out. And are you finding others that are really taking that step forward and reaching out and utilizing that more?
Yeah, definitely. It's just being able to connect and talk to someone who, whether it's myself or colleagues who has expertise in the field when it comes to dealing with stress. You can just sort of see that release, that stress dissipate. And the feedback has been vocal, appreciative, and we're here to help during this time, just as the workers in the ICUs, the emergency rooms are there to do amazing work. We're also here for our clients and anyone who needs help.
Absolutely. And from the comfort and safety of home, it certainly allows a lot of time for reflection, doesn't it? More of that connection and time with family, and having a window in that you normally might not have a chance to see and also to share within your space. So I thank you for inviting us into your home here today. And, tell us also, what are some of the concerns and conditions that you're seeing coming up in this area with, depression and grief, or with anxiety and panic attacks.
Right. So, I think what's different about this sort of experience is that many individuals who maybe weren't suffering at a psychological level are now sort of beginning to sort of present with certain symptoms: sadness, loss of interest, excessive feelings of guilt as it relates to not being able to connect with loved ones who may be suffering now, low energy, difficulty concentrating. We're seeing that with children, adolescents who are now being homeschooled. Loss of appetite or eating too much to sort of deal with the boredom, or restlessness. And we're seeing individuals struggle with severe anxiety as well, panic attacks. But what's great about this is that there are resources that one can implement to get through this time, regardless of whether you've experienced this before or this is sort of new for you.
Yeah, that's great. And especially when we may have more sedentary lives right now, just spending more time in the home, doesn't it offer the creative opportunity to come up with things that we can do to stay more active? Too. I would love to hear from you about, other things that you feel are helping at this time, maybe some general tips about how to improve mood, and what are some things that you feel would be a really good staple for people to practice?
Yeah. So you mentioned the sedentary aspect of this time. And, I think what's helped clients, what's helped family, what's maybe helped myself is creating structure, really attacking the day. So a couple strategies. So waking up and saying, today is going to be a good day. So when you do that, you're priming your brain, and your brain is going to look for an explanation as to why today is going to be a good day. When you do that, you're releasing positive neurotransmitter serotonin, which helps us relax and feel calm. And you're just paying attention to more of the positive, and our brains like that. So starting the day out with today is going to be a good day. Focusing on what we can control, right? So we're not sure when a vaccine is going to come. We know that it will come, or we believe that it will come. But we can focus on decreasing the transmission of this disease, right? The CDC and the WHO have released guidelines. We can practice social distancing. We can wash our hands for 20 seconds or more, hot water. We can wear a mask when we go out. So there are things that we can control that can help decrease the spread of this virus, that can get us back to where we want to be. So we have more control over things than we realize. So focusing on what we can control. Adopting a rational mind. So I think this is very important. So question your own thinking, challenge your own thinking. So here we're talking about kind of adopting a Socratic method like Socrates. So we want to ask ourselves, when we're confronted with a thought, say the thought would be, we're doomed. This is never going to go away. We want to ask ourselves the following questions. So we want to first identify the thought. The thought is, we are doomed. We are never going to get better. This is never going to go away. Now we want to challenge our thinking. So is it 100% true that this will never get better? Are we not making progress? Actually, we are making progress. We're improving. Morbidity, mortality, while it's there, we've seen in other countries the spread has decreased. We're improving on that level. So is the thought true? Is it 100% true? No, we are going to recover. How do we feel when we believe that we're not going to get better? We feel scared. We feel sad. We worry about our loved ones. So these are uncomfortable feelings that follow this thought. But when we kind of challenge this thought, how do we feel? We feel relieved. We feel hopeful. So the questions we want to ask, we first want to identify the thought. We want to ask then, is the thought true? How do we feel when we believe the thought? and how do we feel when we refuse to accept the thought. So starting our days with today is going to be a good day, focusing on what we can control, adopting a rational mind. Disconnecting from news is important. So I spend maybe 5 to 7 minutes a day on watching the news. Some research has shown that 14 minutes of negative news can increase symptoms of depression and anxiety. So be careful what you expose your mind to. And finally, when you're going to sleep, ask yourself, what went well today? So you'll review and you'll find your brain will pay attention to the things that went well. And when you do that, again, your brain feels good. And when your brain feels good, you feel good. So those are some practical strategies to help during this difficult time.
Thank you for sharing those. And I really appreciate that you have this brain-based approach to treatment. And really, how has this changed the way that you see your clients and the way that you treat your patients?
Right. So we take a brain-based approach, which means we look at the brain in terms of systems. So where are depressive symptoms coming from? Where are anxiety symptoms coming from? When we can understand where that's coming from in the brain, then we can target those areas more specifically. So without going into too much medical jargon, there are different brain systems that we pay attention to. For instance, the frontal lobe, which governs our ability to focus, to sustain attention, is involved in our everyday functioning. So when that's off, that can affect how we feel. Our limbic system, our fight or flight part of the brain, when that's working too hard, we can feel isolated, sad. We have other areas, which we can maybe go into on another recording. But using this sort of approach has helped me identify more clearly where symptoms are coming from, and then targeting those symptoms in a more specific manner in an effort to help an individual faster. And
That makes a lot of sense on the kind of unique window and lens that you have on seeing and hearing those brain systems based off of what clients may share or assessments. And really also, we know that pharmacological options and treatment are available. And I know that you really embody an integrative approach in practice, but when is it time to consider medication?
Yeah. So I think the first step is to say that sometimes medication can really help us. We don't want to just jump to medication, but acknowledging that, hey, this is a difficult time. If you are struggling with symptoms of hopelessness, you're not, the will to live is diminished to suicidal thoughts. If you're not sleeping, if you're not able to manage anxiety naturally through the techniques that I described, or through deep breathing or meditation or exercise, then it's worth sort of seeking help and then working with a clinician who can help guide you. You would talk to a clinician, and the clinician would sort of help you make that decision. But taking that step, there shouldn't be a stigma around that. This is a difficult time, and if an individual is really struggling, and just seek out help, and we're here for you.
Well, Dr. Sood, thank you so much for sharing today. And thank you all for being here. Our Amen Clinics team is here to help. And if you or someone you care for is struggling, but you feel like you have to wait for life to get back to normal before addressing these important mental health care needs, know that you don't have to. At Amen Clinics, we offer an in-clinic telehealth services by phone, video conferencing to help our patients. And so you can find out more by speaking to a care center specialist. You can call 888-288-9834. And we're wishing you and everyone in our United community the best for brain health and wellness. Thank you so much again, Dr. Sood.
Absolutely.
Take care.